Our top story, more on the coronavirus vaccine. Walgreens is starting a program today to vaccinate residents and workers at nursing homes all across the country. And joining us right now exclusively from inside a Walgreens store in Boston is the company's chief medical officer, Dr. Kevin Ban. Dr. Ban, good morning to you. Thanks so much for being with us. I want to start right now by bringing up a live shot because you've got some good news. Take a look. Here we go. Crown Point Care Center in Columbus, Ohio. We're about to see resident Rebecca Meeker receive the vaccine right now. And Dr. Ban, this is a big deal. This is the first time Walgreens is administering the vaccine to a nursing home resident. Why don't you walk us through what we're seeing, how long this is going to take, and how many folks you expect to vaccinate?
Right. So this is a great moment. There's a deep sense of pride that all of the people at Walgreens feel. All of this started back in January when the scientists were able to actually put together the vaccine. And then over the course of the last several months, they've been going through the phase 1, 2, and 3 trials. Think of it like a relay race, you know, where we're passing the baton on. And finally, we have the baton, and we have to get us across the finish line. We're in 3 states today: Ohio, Connecticut, Florida. 10 clinics, but next week we'll be in 12 states and over 800 clinics. We're moving and ramping up to 35,000 clinics across the entire country. We're going to vaccinate more than 3 million people in these long-term care facilities.
And you're starting there at a nursing home. Nursing homes, as we've been saying for so many months now, so hard hit in this pandemic. Nearly 40% of the nation's death toll is coming from facilities like a nursing home. So time is of the essence for you as far as these nursing home goes.
That's correct. And I thought the CDC did a great job in setting guidance around this. First of all, let's get the vaccine to the people who are at the front lines of this, the healthcare workers. And that started this week. And now you can see today we've started with the long-term care facilities, and we're going to scale that out over the course of the next few months. This is called phase 1, and we're pointing towards phase 2, which we expect to happen, as Dr. Fauci has pointed out, sometime in March. So that's when we will begin, let's call it March, early April, the vaccination of the general public in phase 2.
And as you were talking there, we were seeing yet another resident get that vaccine at that care facility there in Columbus, Ohio. I want to talk about Walgreens and national chains like yours. You're going to be playing a really big role, a major role in the distribution across this country. You've likened what you're about to embark on as giving out the flu shot. You say you've already got the infrastructure in place.
Yeah, that's correct. You know, over the course of the last 15 years, we've been building out our vaccine program. Over the course of the last 5 years, we've conducted more than 150,000 flu clinics that are very similar to these COVID clinics. So we feel like we have the expertise. Really, the point now that we need to focus on is good education for people. People just want information. I've been tracking this since January, very encouraged by the early studies and now the phase 3 studies. But for a lot of people, this is new. So I want to ease people's concern. I want to bring as much good information. All the touch points have been met here. The effectiveness is exceptionally good. More importantly, this is a safe vaccine.
This is a safe vaccine. How is this going to work just on from a logistical perspective? People have to make an appointment to go in. They just show up. How's it work?
Well, right now we are focusing in on phase 1, so there is no list. You cannot make an appointment unless you fall into phase 1. When we get to phase 2, what we want to do is, again, lean into our platform, our technology, so that people will make an appointment in advance. We can do that. You can call on the phone. You can go onto our app. It's called My Walgreens. Or you can go to our website. Now, when it is time to do that, the CDC, Walgreens, and the state governments will make this clear. We want to make it as easy as possible for people to schedule that appointment in advance so that we can keep everyone safe. We're in the middle of a pandemic, and we don't want people all coming at once.
Dr. Kevin Ban, thank you so much. It is a great sight to see those vaccines being given this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.